All right, everybody. Hi, Carl Rothschild here. I'm going to be talking today about light therapy. We're going to have plenty of time at the end to answer questions, which I hope you have. I'm also going to be introducing my associate, who's an expert on all this, and I've gotten her to set aside 15, 20 minutes for each of you to do a consult with you. So if you have any questions, she can answer them better with that one-on-one process. As I had mentioned to some of you earlier, I started in my practice in Los Angeles in 1978. And I was pretty good. You know, it's probably as good as any of the other chiropractors in the area. But then, about 20 years in, I was introduced to light therapy, and I started with it in my practice. And you're going to think I'm sounding over-the-top crazy, but I'm telling you, it revolutionized my practice. It changed everything for me. I was able to do things I never dreamt of being able to do. You know, people come in and go, what about my rotator cuff? Boom, I was healing that. And what about my ripped Achilles tendon? Boom, I did that. From the bottom of the feet to the top of the head, every bone, muscle, tendon, ligament, I took on all challenges because you know what? It can't hurt. There's a way my father would say, it can't hurt. It couldn't hurt. You couldn't hurt somebody with this if you tried. It's as dangerous as a flashlight. But the upside is unbelievable. But then, about 8 years ago, something really weird happened. I'm being told 8 years ago that it shrinks fat cells. And it does it in such a way that is natural. It's not harmful. We're not cutting anything out. We're not injecting anything into the body. We're able to shrink fat cells. Now, I've been involved with weight loss since I started my practice in 78 and many years before that because everyone in my family struggles with, the only reason I'm not huge is because I have to work at it. And I'm going to show you in just a moment that I screwed up during COVID. But anyhow, learning about fat reduction, I started getting involved with manufacturing. I said, I really want to be on the front line of this because I believe this is incredible. And over the years, we've developed different devices. And the most recent, most current device is called the Trifecta Lite. It's more powerful. It does more than anything we've ever seen before. And the reason why it's called the trifecta is it's the triple threat of the face, the fat, and healing. Face, fat, and healing. And then we also learned, wait a minute, it doesn't just do those three things, but I don't want to change the name, so we'll call it the Trifecta Lite Plus. It also does amazing with cellulite. Now, as a chiropractor, I wasn't involved with the aesthetic world of cellulite or facelifts or all that sort of stuff. But, oh, my God, if you want to market and you want to build a business, you don't want to avoid those things. It's incredible what you can do when you add these things to your practice. So as I said, COVID kind of did me in, and I didn't even realize it. So my gym closed. The kids were home, I would say, all the time because they couldn't go to school. We couldn't go visit other people, and it was stressful. And I didn't even realize how much weight I had put on. I mean, I don't know what happened, but I saw a picture of myself, and I said, this is no good. And Jim talked to me about, well, why don't you take care of yourself? And I got back on the lights, and I included a very smart diet that at the end, Kathy's going to talk to you about adding a diet with the lights, and it's a killer. And so in 6 weeks' time, I lost that weight. And the process of this is, remember, I'm an expert at weight loss. I've studied it. I've done the whole thing, and I apologize for putting on the weight. But I teach this all the time, and it's easier to lose the weight than it is to keep it off. So that's why a smart diet, like what Kathy's going to talk to you guys about, is a great way of helping the lights. But the lights help the diet. I mean, I was dealing with weight loss with my patients from day one. It's not so easy, but when you add the lights, it makes it that much easier. So I want to point out the fact that people are nuts out there, and they'll do anything to lose weight. They'll, inject things in their body. They'll take crazy pills. They don't care. Well, we care, right? Because we want them to look better. We want them to feel better. But guess what? We want them to actually be better. And the lights plus a smart diet will help them to actually be better. I'm telling you that the lights plus a smart diet will increase their energy. It will actually change their mood, not just because they look better, but because internally they actually are better. And we're getting people calling about, I have a better feeling about my life, less depression, as I said, more energy. There's so many things that the lights do beyond just shrinking fat cells or healing. And I really feel, and I know this sounds a little over the top, I really feel like I found the answers to my prayers. Imagine, effortless and healthy weight loss. So let's look at this picture. You saw a picture of me. But this lady wasn't just overweight. She was unhappy with the way she looked. And because the unique thing about the trifecta light is it doesn't just shrink fat cells, it makes them look, the skin actually look fantastic. And the combination of lights that we have and the wavelengths that we have don't only shrink fat cells, but they tighten the skin, they get rid of the sagging skin, the stretch marks. On the skin, the results are absolutely amazing. And our program typically takes about a month or two. This is a 6-week this was 5 weeks, 2 to 3 times a week. And of course, this lady was ecstatic. And guess how many people she referred to the facility? A lot. Now, we talked about effortless, healthy weight loss, but what about that facelift I had mentioned before? And we call it facial rejuvenation. It's amazing what you'll see the results. Now, this is a 72-year-old female. Look under the chin and jowl region and the wrinkles and fine lines. And this only took 4 sessions. Are you ready? It's unbelievable what happened. And yes, she referred a lot of people because of this. Look at under the chin. Look at the face, the fine lines and wrinkles. And I didn't take these pictures. She did. She was ecstatic and had amazing success. With this, and yes, as I said, she referred a lot of people because of that. And then we also talked about cellulite, the old trifecta plus thing. Now, this lady wasn't particularly overweight, but she hated her legs. She was embarrassed by them. And this next picture is going to look photoshopped. I've gotten that comment before. And I don't know what else to tell you, but it wasn't photoshopped. And this was a 3-week program, 2 to 3 times a week. And boom, I'm telling you, it was absolutely gorgeous. Cellulite responds wonderfully to the lights that we use. So we talked about effortless, healthy weight loss, anti-aging facelift, and we already discussed the natural healing. It's hard for me to show you a ripped Achilles tendon. It's hard for me to show you a torn rotator cuff and all that stuff. So what we have here is a picture of a severe burn. Now, this lady was in agony. This lady was told by her people that she was going to, she went to a wound center. It was going to take 6 months of pain, 6 months of healing, and when it's all said and done, there would be scarring and drugs and all kinds of stuff. And Angela, are you on here with us?
I am. Can you hear me?
I can, yeah.
Awesome.
Angela, these pictures actually were sent in here by Angela. So tell us a little bit about, maybe a little bit more history about this.
Okay, so this lady actually, this was her very first time in my clinic, and apparently she had a cup of hot tea on the counter in the morning, and she backed up and knocked it off the counter, and it splashed on her. This is her behind buttocks inside of her thigh area. And this is literally what happened when she came in. And I didn't even get to see this wound because it was way worse than this picture prior. And I said to her, her name was Yubov, which means love in Russian, so I had to love her. I said, we're 99% sure, and I've seen before that it can help to heal wounds. So let's just put it through the gauze bandage and see what happens. And then literally not even 3 weeks later, twice-a-week treatments. Eventually the gauze came off. There's a bunch of pictures where the skin sloughed off. And then 3 weeks, that was completely healed with no scar. And I was amazed. She was amazed. And pretty much everybody else out there is pretty amazed by it.
Right. And you've had, I mean, Angela's treated more people than probably most of our practitioners, and she witnesses this all the time.
Example for my dog.
Right. Oh, yeah. I don't have those pictures, but Angela was telling me about her dog, and she's pretty attached to the dog. And the dog had. Well, go ahead and tell us. I'm going to give you 2 minutes, and then I got to move on.
Okay, so she's my service dog, so she means a lot to me. I've had her since she was 7 weeks old. She has a skin condition that's called deep pyoderma. It is from overactive bacteria on the skin, and it literally causes horrible. You guys can look it up later. It's bad, really bad, and the skin necrosis and everything. The vet, year and a half trying to figure it out, $3,000. Finally, she was in such bad shape that they were like, well, we have to do a biopsy. And I thought my dog was going to die. So I'm starting to Google, does red light therapy help with pyoderma in dogs? And they're like, red light therapy kills the bacteria. And I was like, are you kidding me right now? I've had the solution the whole time. And we'll show you the pictures later if you care. But it was like so disgusting. And 2 light therapy treatments in 2 days made a 75% healing success in my dog. She's happy.
Wow.
She's playing. She's eating. It's amazing. I had no idea. But fungus, bacteria, viruses, and, apparently kills a lot of it. Staph, good for that. Cool stuff.
Well, Angela, my staff actually put together some of the most common conditions that our doctors all over the country are reporting. I didn't know about Lyme disease, and sure enough, shingles, Lyme disease. I mean, you can create an entire career from any one of these categories. And, if I hadn't mentioned this before, probably the most popular thing to market is giving away money. And not right under that is effortless, healthy weight loss. And a little bit under that, and what pays a lot of money, by the way, is peripheral neuropathy. And the Facebook doesn't like skin, so any images that we have for Facebook are always going to have dress. But the lady would be in her bikini. And what we'll do, some of you, if you don't know, I've been involved, as I said, with light therapy forever, and I've had a Class 1, Class 2, Class 3, and a Class 4 device. And if I were to do a Class 4, my final device I had before I got involved with pads, if I were to do that with this lady, I would laser all the way down the spine, laser and emphasize the sciatic notch, and down the leg, and then each foot, if it's bilateral, at least one foot. If it's not bilateral, that's a 15 to 20-minute investment of my time. If it's bilateral, it's more. It's a lot of time, a lot of energy, and when I'm treating this area here, nothing's happening up here, nothing's happening down here. But if we switch this out and do pads, and again, remember this model, if we were actually treating, they'd be in a bikini or underwear. We put a pad down the spine, we put another pad down one leg, if it's bilateral, both legs, and we wrap each foot. Boom, takes 30 to 60 seconds. And the hardest part of this is setting the timer and waving goodbye as you walk out of the room and come back 20 minutes later. It's easy. It works unbelievably well. This person can come into your office with these weird sensations in their legs where they can't walk. And sometimes just right after the first session, they'll feel remarkably better. But at least by the third or fourth session, they are feeling phenomenal. And our doctors are charging upwards of $5,000 to $10,000 for a neuropathy case. Then remember, we talked about finding answers to my prayers. One of the things is an all-cash business and getting away from insurance companies. I had a little laugh the other day. I was listening to a conversation in the background while I was talking to a person who was thinking about getting involved with lights. And in the background, I'm hearing them talk about co-payments and deductibles, and I'm thinking, man, I haven't discussed that with anybody in 6 or 7 years. Oh, my God, I don't want the insurance companies telling me what I'm worth. I don't want the insurance companies telling me what this service is worth. I don't want the insurance companies, paying so little. And remember, it's unattended service. We're doing unattended. What do you think an insurance company is going to say the value of an unattended light is? It's ridiculous. So our doctors don't charge less than $100 for this kind of work, and many of them are charging hundreds of dollars per session. So forget about insurance companies. No more attorneys. And I know attorneys better than I wish I ever did, and they're no longer working for us. Maybe they never were, but it's ridiculous working with attorneys. It's easy. It's quick to administer. It does not require a health practitioner's license. So we train and certify you and your staff, and you don't have to do this. You just want somebody that's healthy looking to put the pads on. And again, their hardest part of it is waving goodbye as they walk out of the room. And I challenge you to find people who are an adult that you couldn't help. It's a huge percentage of the population are going to need face, fat, healing, cellulite, something. I mean, I'm telling you, I have had over a dozen practices, not all at the same time, and I always wanted to cast the widest net possible. What wider net could you cast than this? So what should you look for in a light therapy system? First of all, obviously made in the United States. You want something that, for customer service reasons, for repairs or anything like that, and for quality, you want it made in the United States. In the old days, I will tell you, 10, 20 years ago, lasers were way more powerful than LEDs. That is no longer true. Our LEDs are just as powerful as laser, but we're covering huge swaths of the body, huge parts of the body at the same time. Obviously, you want as much power as possible, and you want direct skin contact. As you come off the body, and there are devices out there, come off the body, you lose power exponentially. You want skin contact. The second thing is actually the fifth thing, you want a dual wavelength, both the the red light series or wavelength, which is wonderful about shrinking fat cells and does a little bit of healing. And NIR stands for near infrared. That's not infrared, that's near infrared. And if you've ever heard of cold laser, that's the cold laser. And the reason why they call it cold laser is because it doesn't heat up. Near infrared is amazing, not so much for shrinking fat cells. In fact, it almost does nothing with that. But it's what does all the other stuff. Stretch, it's going to contour the body, get rid of stretch marks and all the sagging skin. It's going to get rid of the fine lines and wrinkles and all that sort of stuff. And that's why our face mask with our device emphasizes the near infrared, whereas the body pads, which we're going to be doing healing and fat loss, has more red in it. And then, of course, as I had mentioned before, you want as much tissue coverage as possible. So the setup looks like this. You're going to, this is a full body setup, so you're doing both thighs, the buttocks, and the abdomen, the bra fat area in the arms. That's 8 body regions, plus the under the chin and jowl region with the chin pad, and then the face mask. That's 10 regions all at the same time. But if you notice, our device is a plug-in system, so we haven't plugged this in yet, so there are no wires here. And I just want to read this because I can't say it as well as I had written this in the past. It's not an easy task to take an electronic component and wrap it around a human body all day and maintain a product integrity. Trifecta Light has been able to overcome the issue by designing and constructing a proprietary pad system that will stand constant client use. Our patent-pending design is made for superior performance and reliability, and it does all of this by using superior wiring and a unique plug-in system. So what we're talking about here, and notice it's reinforced, and we're going to plug into the pad. Past systems and old systems, they would plug, the wire would go into the guts of the wire, of the pad, and if there was any breakage, it would occur inside here and ruin the pad. Well, that's why we use an external jack, and we just plug it in. So how does it work? Listen carefully. That unique light that is emitted from our Trifecta Light system causes the fat cell membranes to temporarily alter the permeability of the fat cell wall. This brief change allows some of the fat contents to be seeped out where it can then be processed by the body. A critical part here is that it's temporary. You're not changing anything on a long-term basis. So you're not damaging anything. You're not ruining anything. The fat cells are still healthy as can be. And not like these other things which destroy fat cells. It's nuts. I'm a chiropractor. I'm not interested in destroying essential tissue. And they haven't done enough research, but there will be a time when they'll prove to you that destroying fat cells is nuts. Fat cells are critical for the body. They're involved with stem cell production. They're involved with hormone production. And guess what? One of the hormones that it produces is involved with appetite suppression. Why would I want to destroy those fat cells? These other things destroy fat cells. We don't. So what happens to the fat? Well, After being released, the fat is broken down into its components and then taken to the liver by the lymphatic system. And here, the contents are either used or quickly eliminated by the body. So what can your patients expect? During the treatment, your patients are going to be lying down on a treatment table. The pads will be positioned in strategic places on their body for around 20 to 30 minutes in a session. Now, in our in our training that you'll have once you buy one of our devices, we teach you to know what is the frequency and what is the time elements. For some people, it'll be more frequent. For some people, it'll be 20 minutes. Some people, it'll be 30 minutes. Now, also, all the other devices that are out there that we've used in the past are set to the lowest common denominator. What I mean by that, because they don't have any way of controlling the power that's generated to the pads, that they would set the pads to a number that would not be uncomfortable for a thin person. And, so if you're putting this around someone's ankle for healing, putting it around someone's wrist, arm, or if you're putting it around a person's belly who's not that big but they still want to lose some of that, if it's set to a very high number, it will be uncomfortable. So all the pad systems in the past and all the lights in general were set to the lowest common denominator. Well, that wasn't smart for us, and what we did is we created a power dial. So if you have someone that's 100 pounds overweight, you're going to set the power to the maximum and to the patient's comfort, obviously. If their person is a little bit less big, if they're smaller, then you can just power down a little bit and with the lights, and so you'll be able to get the maximum results for each individual. So what areas can be treated? Well, I think I mentioned to you before, but it's basically used on all the essentially on every part of the body where localized fat deposits exist that are resistant to diet and exercise. This includes, as I mentioned before, under the chin, the abdomen, the hips, thighs, broad fat area, and the arms. In fact, as I had mentioned also, it's 10 full body. For the full body, we're doing 10 regions at the same time. What are the risks? I'm telling you, there are no known risks or side effects involved with the trifecta light system. It's completely safe, and it's a completely safe alternative to invasive procedures such as traditional liposuction. It's 100% non-invasive, doesn't cause any bruising or scarring. There's no downtime, so the person can be getting treatment and go back to work. The process is the only thing we're going to ask them is to be a little bit smarter about what they're eating. Do they have to follow a diet? Obviously, your clients are going to expect better results if they reduce their caloric intake somewhat and increase their water consumption to 8 to 10 glasses a day. Meanwhile, we do want them to reduce their alcohol and soda consumption. That'll also help. But I want to tell you, I'm an expert at diet. I'm an expert at weight loss. I've studied the whole thing. And one thing there are two words you want to avoid with somebody who is trying to lose weight. One of those words is deprivation. The other one is starvation. If the person feels deprived during that diet, yeah, maybe they'll lose the weight, but it ain't going to be sustainable. You want a diet that they're going to be able to not only lose the weight, but keep it off. Because a year later, if they put all the weight back on, you're going to look like a failure. And we teach you and work with you to make sure you have these people keep the damn weight off. So what do they have to exercise? So each of their patient sessions should be followed by at least 10 minutes of exercise to stimulate circulation and help burn the fat that has been released. And that's why we include a whole body vibrational system with each purchase. I'm not going to let the person leave my office without getting them on, and it's part of the thing. It's not optional. They can't say, look, I'm really busy, I got to go. They got to schedule that within it, that 10 minutes on the whole body vibration. The whole body vibration moves the lymphatic system better than exercise. So that's why we actually include, we don't want to have you have an option either. You're going to have a whole body vibrational unit in your office, and they're going to go on that for 10 minutes, and that will accelerate and enhance the results that you're going to have. If you're not currently offering, in my opinion, this type of service in your practice, I believe you're working at a distinct disadvantage. The way one of our doctors put it, and I think it's a little harsh, but they said, look, if I opened up next door to one of these people that everything else is exactly the same, but they don't have a set of lights like these, I'm going to put them out of business. And they're not that far from being right. You want to have something like this in your business. And so you want to make sure also that these people are busier than ever. And that's what happens. Our people are busier than ever. And there's a video on our website that shows that our people are, through the COVID, through whatever, they're busier than ever. It will dramatically increase a person's income. I was talking to one of the other people earlier, that we have one of our doctors just called me, and I hate this guy. He's doing $250,000 a month in business. I hate him because he's making more money than me with my lights. So it's a new client machine. It's going to drive more people to your business than you can imagine, and your current clients are going to rush to sign up for something like this. Typically, we recommend somewhere between 8 to 30 sessions. Depends, if they only have a couple of pounds to lose or a lot. Obviously, there are factors that are involved determining whether you're going to prescribe, more visits or less. The treatments, as I mentioned before, is 20 to 30 minutes. And ideally, we're going to see the person, just like if they're working out and exercising or chiropractic. If I've got somebody in an active program with me, I'm going to be seeing them 2 or 3 times a week. So what do we include in the program and the sale? We include the controller, the 6 body pads, the face and chin pads. So there's 8 pads altogether. The customized card, the lymphatic massager, which helps, and it's cordless, so it's really great to actually move the jiggly fat even better. So after we've used the lights, we're then going to use a lymphatic massager. We also include the body comp analyzer, which I love this thing, and it's a critical aspect of working with the person and determining the level of success that you're having. We include, as I mentioned, the whole body vibrational system, the marketing material, which is the posters, pamphlets, business cards, referral cards, and a whole bunch of other stuff. We also include the waiting room videos and book, the one-on-one trainings, and the Facebook marketing. And in regards to Facebook marketing, I'm telling you, there's nothing out there other than giving away money. There's nothing out there that's going to flood a facility like effortless healthy weight loss. And we will flood your office, or let's just say comfortably flood your office. Most of our people are 2 to 3 months booked in advance. And of course, we also include unlimited customer support. Our company's motto is that, I don't know if I call it a motto, our theme of our company is that we go to work for you after you buy the device, not getting you to buy the device, but after you buy the device. So we emphasize the customer support is very critical. We include the training, the customer support, the whole thing. So people will ask this question, what is the return on investment? Typically, a lease is somewhere around $500 to $600 a month. The average package that people sell is around $2,400. I'm one of these guys that under-promise and over-deliver. So our average package is usually much more than that. And the monthly gross is also typically much more than that. But this is what you can minimally expect. After you've been doing the program for a few months, you're going to be expecting to get at least $10,000 to $20,000 a month in extra income.
All right. Thank you, Carl. Really appreciate it. Much appreciated. And Angela, thank you for the share. That was great with the dog. Who would have ever guessed red light therapy for animals? And we know it works for humans, so that's incredible. Again, thank you, everybody. Appreciate it.
All right. Take care.
Thank you.
Bye-bye.